When a physical threat appears, your nervous system acts immediately. Your heart rate increases, your muscles tense, and your focus sharpens. This baseline anxiety is a functional, evolutionary tool built to keep you safe in high-stakes environments. An anxiety disorder occurs when that natural fear response uncontrollably escalates. The body triggers extreme, overwhelming reactions that are entirely out of proportion to the actual situation at hand. The primary marker of a clinical condition is interference. Rather than aiding your survival or focus, the anxiety actively paralyzes you, making it difficult to get through normal daily routines. Feeling nervous before a job interview or a final exam is an isolated, temporary reaction to a specific stressor. A clinical disorder leaves a person navigating a chronic, inescapable sense of dread that doesn't simply subside when the event is over. This persistent state of alarm represents a mechanical failure in the body's biological hardware. Treating it requires clinical intervention to recalibrate the system's baseline. In the U.S., 12% experience specific phobias, 7% social anxiety, and 3% generalized anxiety. Women are twice as likely to develop a disorder. This spans all ages, from separation anxiety in toddlers to generalized anxiety in older adults. These percentages translate to tens of millions of Americans experiencing the same biological overdrive. In any medical practice, managing these conditions is a daily primary responsibility. Inside the brain, the amygdala manages fear. Encountering a threat, it fires a brief pulse to alert the body, then powers down. In anxiety disorders, it misfires at non-threatening cues, flaring aggressively, stuck in a continuous state of alarm. Normally, neurotransmitters, specifically serotonin, dopamine, and GABA, regulate this system, signaling when danger has passed. If we zoom into the synapse, we see a physical chemical imbalance. This chaotic transfer prevents the all-clear signal, locking the nervous system in overdrive. Families pass down genetic traits. Having a close relative with the disorder acts as a biological multiplier, increasing the baseline risk for these chemical imbalances. External environments dictate internal chemistry as well. Severe, long-lasting stress or traumatic events physically alter the delicate balance of these neurotransmitters over time. The overwhelming psychological feelings of dread and panic are the downstream, inescapable effects of a physiological, neurological overdrive. This internal overdrive forces the body to react physically. Patients experience severe heart palpitations, shortness of breath, numbness in their extremities, and chronic insomnia. These intense physical reactions mimic other serious issues. Doctors first run blood tests to rule out underlying physical diseases, like hyperthyroidism, before evaluating mental health. Once physical diseases are ruled out, psychiatrists rely on this standard reference manual, the DSM-5, to categorize how this biological misfire presents in patients. The manual outlines specific categories: generalized anxiety disorder for constant, unrealistic worry, panic disorder for sudden, unprompted attacks, and targeted fears like agoraphobia, the fear of open or crowded spaces. The physical symptoms are universally disruptive across the board, but a precise diagnosis is required to target the exact nature of the biological misfire. A patient cannot will away a biological misfire. Left untreated, a nervous system locked in permanent overdrive leads to severe long-term complications. The longer the condition remains untreated, the greater the physiological toll, actively driving up the risk for severe cardiovascular events. Psychologically, secondary risks branch out. Untreated anxiety frequently leads to major depressive disorder and substance abuse. With the heart under constant strain and the brain's chemistry shifting towards secondary disorders, medical intervention becomes a physiological necessity. The damage from inaction is both measurable and cumulative. Recalibrating this alarm system requires a dual-pronged approach: chemical recalibration alongside behavioral rewiring. Medications target the physical machinery. Antidepressants, like SSRIs, slowly adjust how the brain uses specific chemicals over time, while beta blockers can immediately suppress acute physical symptoms, like rapid heartbeats and trembling. Cognitive behavioral therapy, or CBT, handles the software. A professional helps the patient identify the specific thought patterns triggering the alarm, systematically rewiring how they react to troublesome feelings. In exposure therapy, professionals build a safe environment to introduce the patient to their specific fears. This controlled process physically builds tolerance, proving to the brain that the threat is manageable and the alarm isn't needed. Anxiety disorders are common, biologically driven system errors. But with professional care, targeted medication, and guided therapy, the brain's alarm system can be successfully reset.